Hi, everyone. I am Carrie from Seacoast Mental Health Center. I am the agency's coordinator, and I also teach mental health first aid. So, for those of you who don't know, mental health first aid is an 8-hour course that teaches people how to recognize the signs and symptoms that somebody might be experiencing a mental illness or a mental health crisis and how you can help that person. So I am here to talk to you a little bit today about how you might be able to help somebody who's experiencing symptoms of a mental illness during this particular time. So it might be easier than you think it is. It doesn't require any sort of special training. It really just requires two things. One, the ability to recognize that somebody is having a difficult time, and two, the ability to offer that person care and concern. So, um, basically, what mental illness might look like is going to vary greatly on the individual. So, it might look different for everybody. Essentially, when we're talking about mental illness and symptoms, they are symptoms that are going to affect the individual's behavior, maybe affect their emotions, the way they think, and also cause a disruption in the person's ability to go about day-to-day tasks, interrupt their ability to um, uh, go to work, or interrupt relationships with others. So essentially, there's a disruption in the person's ability to live, laugh, and love. That's the easiest way to put it. So, what actual symptoms might look like, again, it's going to vary from person to person, but it could look like withdrawing from others. It might look like neglecting responsibilities. It might look like sleeping too much or too little. It could be irritability. The person might display or complain of physical sort of symptoms. So, headaches, stomach aches, back aches. Um, the person might be constantly worrying about, their particular situation, or, really constantly worrying about the situation as it is now with COVID-19. So again, it's going to look different for everybody, but the most important thing to note is that you notice that there is a change in that person from how they are typically. So right now, in particular, with physical distancing, it it might be kind of hard, because we're not seeing people that we usually see on a day-to-day basis. So it might be having to look for different sort of cues. Maybe it's somebody that is always posting on social media. They're always posting the funny cat videos or animal videos, and suddenly you're not seeing them visible anymore. Maybe there's a change in the content that they're posting on social media. Maybe they're not responding to your text messages, or maybe they're not responding to your phone calls, things like that. So there's some sort of change that's going on that you've noticed with this person. And it's not really important to understand, and you're not expected to understand the why the person is feeling this way or experiencing these sort of things. The most important thing is to recognize, yes, this person's having a difficult time, and that their experiences are real for them. So, how you can help the individual. So, first of all, don't assume that somebody is going to ask for help um, if they need it. If you think about the times in your life where you might have needed help, and if you think about the times that you needed help but never asked for help, because it can be hard sometimes. So, somebody who's experiencing a mental illness may not come to you and say, "Hey, I need help. Can you do this and that for me?" So, it's kind of up to us to recognize that there's something going on and then to reach out to that person. So, how do you reach out? What do you say? What do you do? It's really not that hard. You are essentially expressing care and concern for that individual. So it could look like, hey, so and so, I've noticed that you haven't been on Facebook lately, and I'm just wanted to give you a call and check in to see whether or not you are okay. It involves listening. So how do we listen? We listen by using more of our ears than our mouths. It involves not giving advice, not trying to solve the person's problem. It just involves listening and being there for that person. And again, expressing care and concern. So, you know, thank you for sharing that with me. It sounds like you're really having a hard time right now. And then you can offer help, and you can offer realistic help that you know that you're able to follow through with. So it could be something like just being present for the person. So it could be something like, I really want to help you. I can give you a call later in the week and check in with you, and we can just have a quick chat. Are you available for a phone call at 2 o'clock on Friday? It could involve maybe, dropping a meal off to them on their porch or something. It could involve giving them resources that would be helpful. So our website, Seacoast Mental Health Center's website, we do have a section that has a number of resources. There's also websites like NAMI that also have a number of resources available on them. So it could be offering them different resources that will help. Um, it could be something like reminding them of what has helped them in the past when they've gone through these sort of symptoms previously, and reminding them of that. So, really recognizing that somebody's having a difficult time, reaching out to that person with care and concern, and offering things that are realistic that you can do to help that person. And you might just want to be aware that sometimes when people are experiencing an increase in their mental illness symptoms, they might not respond with great enthusiasm that you have reached out to help them. So in the moment, they might not be very, like, oh, yay, yeah, I'm definitely going to do this. And if you think about it, it's not uncommon for when people who are experiencing a mental illness for others in their lives to kind of back away and kind of withdraw from them. What's really important is, even though the person isn't in the moment expressing enthusiasm for your help, that you do try your best to be patient and try your best to be present for that person. So Seacoast Mental Health Center is here for you. Our Portsmouth office phone number is 603-431-6703. And in Exeter, our phone number is 603-772-2710. Thanks, everyone. Take care.